When we first meet a patient here at the clinic, when they first come for their appointment, we generally arrange a 45-minute appointment to see them. And sometimes the appointment only takes half an hour, sometimes it takes an hour. But we try and make sure we have adequate time to kind of go through their story about what brought them here and how long they've been trying and their history, and then decide on what investigations might be needed, and eventually if treatment's necessary.
So when we see couples with infertility, sometimes it's a female issue, sometimes it's a male issue, and sometimes it's both. And so we can see everything in those categories. So we might see issues with the sperm quality or count. We might see the woman not releasing eggs. We might see a problem with her uterus or a blocked tube, endometriosis, low egg count. You know, the list is quite long. But with a few simple tests, actually, we can generally figure out what's going on.
Our patients come in with various types of fertility issues. Everybody is different. It may be something as simple as a single woman who simply needs donor insemination. It could be a couple that has been trying for years and years to conceive without any answers, and everything in between.
Most people have one or maybe two fairly straightforward barriers to conceiving. And you know, usually we can figure it out pretty quickly for most patients. So people who are at home fretting and wondering if it's something they're doing or something that's happened to them in the past or why, and fretting about that, should really see someone and kind of get that answer. Because, like I say, in many instances, the answer is a good answer because it's something we can fix.
Olive Fertility Centre is very welcoming. So usually when patients step in, they check in at reception, and then the receptionist helps them to connect with the person they're looking for. So there's a really nice atmosphere at the center to make patients comfortable right away. And also the nurses have a strong focus on welcoming the patient and really explaining how the process is going to look like.
But I know people, and I see patients all the time who have waited for years trying to get pregnant, fearing it's never going to happen, it's not possible without some expensive or exotic treatment, and that's often not the case. We can figure it out quickly and generally treat people.
But the important thing is to make sure people feel that they have enough time, that they're not rushed, and that's a really important feeling for patients here.
First off, being assessed and getting a diagnosis doesn't cost anything in general. So you can see a fertility physician, that's covered by our health plan. All the testing is generally covered by the health plan. And many treatments are covered as well. So if surgery is needed to unblock a tube or to fix some scar tissue inside, that's all covered. Many people don't need expensive treatments either. Some of the treatments might cost $100 or $200 to achieve a pregnancy. And then it goes all the way up to people who eventually need IVF. And that is more expensive. That's close to $8,000 for the treatment. So, but again, it's only about half of our patients ever need something that invasive and costly.
A lot of our patients have feelings of despair at times, or distress at the diagnosis of infertility, or they're partway through a treatment process and feel sad or angry or upset about where they're at. And what I want them to know is that they're not alone.
I want people to feel empowered, and I think that if you give them knowledge, they'll feel empowered. And then I want them to feel like they leave with a clear plan forward, because a lot of what people bring to an appointment with a fertility doctor is anxiety. But if you can leave each visit with a clear plan of what you're going to do next and how you're going to get pregnant, some of that anxiety goes away. Not all of it, but some of it goes away, I think.